bottles of water do you drink a day? To keep a healthy kidney, you should drink around 13.5 cups of water per day. In this picture, I have 13.5 cups of water. 13.5 cups equals out to 6 or 7 bottles of water, which I have shown here and here, and also right here. Drinking this water helps you flush the toxins out of your body. When I was a sophomore in high school, I had to be hospitalized for 3 days because of a severe kidney infection from my bladder to my kidneys. To help stay away from infections in your kidney, you should not hold urine, stay hydrated, and keep good hygiene. I will be sharing with you some causes, symptoms, and treatments of an infection within your kidneys, which I get from at activebeat.com. In the points described, I have shared with you my experiences and how to keep your kidneys healthy. How many of you know what a kidney is and what its function is? Your kidneys are 2 bean-shaped organs about 5 inches long and about the size of a large fist, which my fist is pretty small, so it's going to be about double that. And here is a picture shown on my poster. Your kidneys are located just below your rib cage on either side of your spine. Kidneys, ureters, and bladders are part of what makes the urinary tract. They filter blood, remove waste, and extra water to make urine. There are 4 main functions of the kidneys, and I know you're ready to hear them. Number 1, maintain overall fluid balance. Number 2, regulate and filter minerals from blood. Number 3, filter waste from blood. And number 4, creates hormones to produce red blood cells, bone health, and regulate blood pressure. Now you know what a kidney is, what it does, and what it looks like. Let's move on to the next section. Water has many functions, such as helping with acne, keeping your body healthy, and staying hydrated. As a teenager, I know it's really embarrassing to show up to school with pimples all over your face. Water breaks down and puts together molecules. Bottled water is filled with nutrients to help your body. Water helps kidneys remove waste from blood in the form of urine. It also helps your blood vessels stay open so that your blood can travel to your kidneys to get vital nutrients. Your heart is pumping blood to go to all your organs, and if your vessels aren't open for your blood to get to your kidneys, then it won't function properly. Water flushes toxins. This makes you need to go to the restroom, and in this process, it cleans your bladder. Water, known as H2O, has more functions, but we're only discussing a few. What is the worst pain you have ever felt? Mine was when I had a kidney infection. I'm going to share with you the symptoms that go with a kidney infection, and trust me, I've felt them all. First, there's a sharp pain in your lower abdomen. This is the infection starting in your bladder at the end of your urinary tract. The cause, you might ask? Bacteria in your bladder. If treated, the infection stops and your problem is solved. But if not, the infection grows and travels upward toward your kidneys via the urinary tract. If the infection makes it to both right and left kidneys, you could be at risk of getting the infection to your bloodstream and going to your heart. The infection in your bloodstream is called sepsis. It can be fatal, but sometimes it's not. I was fortunate to only have 1 kidney affected, which was my right. This kind of infection is called pyelonephritis, a long word and very painful. Next, the pain will travel to your lower back and middle back. The pain will feel like 1,000 knives stabbing you, and you will need to urinate, but not actually able to. Have you ever had to take antibiotics? Most everyone has. Whether you're this tall or this tall, everybody gets sick. When you first feel pain, you should get antibiotics right away. If the bacteria grows and spreads, as I've shown down here in picture number 3, it can take longer to kill the bacteria. Some antibiotics will not work. When the bacteria spreads to both kidneys, you will likely have to go to the hospital because the pain will be unbearable. At the hospital, they will run tests, take urine cultures, and possibly an MRI, which is very scary if you're claustrophobic. These tests will tell the doctors what medicine will work the quickest. Some infections are immune to certain bacteria, so these tests are very important to the doctors and your health. You should stay hydrated, so they will push fluids in your IV. Now you know all the signs, symptoms, and treatments for a kidney infection. I hope you learned why it is important to drink lots of water and stay hydrated. I also hope you received some information of what a kidney and kidney infection is that I got from at kidney.org. Now, by a show of hands, how many of you need a drink of water?